Good morning, good evening, and good afternoon, and welcome to the first IIGH 2020 virtual lecture series. My name is Sophia Greskin, and as director of the USC Institute on Inequalities and Global Health, it's my great pleasure to welcome you to this incredibly exciting event. For those of you who don't know, as part of the Institute's vision and commitment to building a more just and healthy world, we traditionally bring global health leaders to USC to share their experience and to engage with students and faculty around common themes of interest, and all with a particular focus on understanding and addressing health inequalities here in Los Angeles and around the world. Given COVID this year, we, like everyone else, are doing things a bit differently. And given the virtual nature of things, it allows us to operate across several time zones in ways that can allow events like this to occur. And it opens new opportunities for interaction and discussion. So the fact that we can do something like this is, I suppose, a real positive amongst all else. As Justice Ginsburg, the true champion that we lost this past weekend, has said, "Fight for the things that you care about, but do it in a way that will lead others to join you." And that is what brings us all together in this Zoom meeting and in our work, a deep passion and commitment to health and justice, whatever our circumstances, wherever we live, and whatever our disciplinary entry point. And so we're very excited to kick off our virtual lecture series with a speaker and a talk that, if I may say, with the pandemic and with the fires for those of us in Southern California, could not be more timely. Our hope in asking David Nabarro to speak on the dual challenges of climate change and COVID-19 is to spark a conversation surrounding the challenges that are posed by the current pandemic and climate change to all of our communities, wherever it is that we live, not just in Southern California. And in particular for those with limited resources and where there are long-standing inequities, and from there to move us all into some form of action. For our time together, our program is simple. We have 1 hour where we'll hear some important welcoming words from USC President Folt. We'll hear from our keynote speaker, David Nabarro, and then we'll move into Q&A with you, the audience, and wrap up with some brief remarks from Howard Hu, the new chair of the Department of Preventive Medicine here at USC. And with that, it is my great pleasure to introduce Carol Folt, the 12th president of the University of Southern California, and a great leader with a great commitment to students and a deep commitment to the issues we are addressing today. In fact, the Presidential Working Group on Sustainability that she started is a partner in this event that we are doing here. So President Folt, the floor is yours.
Thank you, Sophia, and welcome everyone. Today's talk couldn't be more timely. You're hearing about two of the most pressing issues of our time, climate change and COVID-19. Their pairing is appropriate. Climate change and environmental degradation have always hit underserved communities the hardest. And as we're seeing here in the United States, the same is true for COVID-19. Our Black, Indigenous, Latinx, and other people of color have been the most affected. And we're seeing particularly disheartening trends emerging, such as the finding that Black Americans are dying at 2.4 times the rate of white Americans. Inequities like these set off alarm bells that warn us we need answers and we need solutions quickly. That's why the work of the USC Institute on Inequalities in Global Health is so important. People in the Institute identify and tackle troubling inequities. They don't shy away. They draw on resources that come with being a major research university with dedicated faculty, passionate students, and abiding commitment to multidisciplinary, impactful work. They also seek out partners from every region of the world and work at the global, the national, and the grassroots level. Today, the Institute is building bridges with the World Health Organization to find out what works, what helps, and what can really chip away at complex inequities in global health. The Institute's director, Sophia Greskin, has shown great leadership building partnerships and in addressing health concerns, not only as a medical question, but as the result of the interplay of social, economic, legal, and environmental factors that influence health in all communities. And that's what sets the Institute apart. Alongside the work of the Institute, USC is doing much to take on these issues in other ways. For example, we've set a bold agenda for sustainability. We have a presidential working group on sustainability, and they're a co-sponsor for today's talk. They're leading the way here on campus. They're building a 2028 sustainability plan that sets aggressive yet achievable goals. We're going to phase out single-use, non-essential plastics, make our campuses zero waste by 2022. We're pushing for carbon neutrality by 2025, and we're adding solar panels at many different locations. But most importantly, we have a community that is pushing for change, students who want to turn the tide for the future, and faculty and staff who are pursuing cutting-edge research and operational changes to drive sustainability. We're seeing this same push for change with COVID-19, and it isn't just research there either. Everyone at USC is lending a hand. We've distributed more than 4 million pounds of food to neighborhood schools, families, and seniors, including 160,000 prepackaged meals and 25,000 bags of groceries. We've made 3,000 wellness and check-in calls to seniors living near our campuses and provided more than 10,000 nights at our hotels for our caregivers and our emergency workers who can't go home for fear of infecting their loved ones. And our faculty are advising K through 12 school superintendents on how to best serve students who can't return to the classroom. And that is just a snapshot of what we're doing here at USC. We hope the work that we're doing can be a blueprint for other communities and universities in cities around the world. How we solve these problems at USC and in Los Angeles with our diverse, dynamic population will hopefully help others see paths forward. But we sure can't do it alone, and we need to learn from what others are doing as well, which is exactly what we have with today's talk. I want to thank today's distinguished speaker, David Nabarro, for partnering with USC's Institute on Inequalities in Global Health and for giving us a global perspective on these issues. Thank you all for joining us, and thank you for caring.
Thank you, Carol, for those kind and inspiring words. And it's now my great pleasure to introduce our keynote speaker. And honestly, it's hard to know where to start or where to stop. Let me try to make it brief. David is the Special Envoy of the World Health Organization's Director General on COVID-19. He is also the former Undersecretary General to the United Nations Secretary General on the 2030 Agenda for Sustainable Development and Climate Change. And he currently serves also as co-director of the Imperial College Institute of Global Health Innovation and as co-chair of the Forum on Climate Change and Health. He brings decades of experience in academia and working for the UK government and with the United Nations, and we're incredibly lucky to have him with us today. One small piece of housekeeping, if I may. If you have questions as he is speaking, please use the Q&A function on Zoom, as we will curate the questions once Dr. Nabarro is done to facilitate our conversation. And with that, David, the floor is yours. And thank you again for being with us.
Thank you, Sophia. And thank you actually to President Carol Folt. I found the introduction really helpful. Greetings to everybody. Yeah, Sophia, who I've known for a long time, and actually really been so impressed by over the years, learnt so much from you, Sophia. It's wonderful to be invited along to meet all the USC colleagues. And you are such an important group of people coming through at such an important time for humanity. So I'm really going to enjoy the next 15 or 20 minutes. And I'm just checking my watch. Sophia, if I go over time, please jump up and down and wave around, because I want to make sure I leave plenty of time for comments and questions. I'm going to focus on COVID, and I'm going to focus on climate. And I'm just going to tell you what my main theme is for my talk, just in case you want to tune out. I'll give you the answer now. Here it is. Humans are great. We are remarkable. We've been given the most incredible capacity for thinking, the most incredible capacity for feeling. We have ability to demonstrate empathy like no other creatures. We have the ability to work in groups, to solve problems like no other creatures. We are blessed. We can do much better at dealing with existential challenges than we are at the moment. And during the next few years, we've got to learn to do better because the existential challenges are huge. You are some of the people who will lead the emergence of humanity into a far greater capacity than has been demonstrated up till now. You are at the university, you are studying, you will move into various roles. You are in United States, this great country. You are in California, this magnificent state. But of course, a lot of work is needed to get things right. And I'm going to talk to you with some of my views about things that you might do as you exercise leadership for a greater humanity. It's not easy work. Dr. Gruskin, who's worked with me and others a lot on issues around HIV and so on, she herself has shown me that the kind of work that has to be done isn't easy. You face opposition. Your friends don't always understand. It's difficult sometimes to explain to your parents or even those you're close to what you're doing. They ask you, why are you working so hard? Why are you so dedicated? Why are you constantly focusing on the needs of people who are poor and who are disadvantaged? And you say what you believe. This might be something like, I've got to work for the good of all humanity, because I know that if we don't focus on equity, if we don't focus on the well-being of our planet, if we don't focus on humanity coming together to find a way forward, we will lose. But if we do it right, we will gain. And we'll have to invent as we go. There's no manual anywhere telling us how to deal with these issues. There's lots of people who will give us talks and lectures and so on and tell us what we must do, but they won't always be able to explain how we do it, because in practice, it all depends on how we work in our own context with the systems in which we find ourselves. And that's often quite lonely work. So here I go. Let's just focus first on COVID. I actually think that an awful lot of people around the world are struggling to make sense of this new virus. It's only been with us, with humanity, as far as we can tell, for 9 or 10 months. And it's already had the most phenomenal impact. And it's very hard to explain to each other how on earth, in a world that's been preparing for pandemics for decades and handling them in various levels of competence also for decades, how on earth has this virus managed to cause so much difficulty for humanity? And how on earth are we going to get out of it? Okay, first, we've got to change the narrative. With every difficult issue, what really matters is the narrative, the story, how we explain it to each other, how we make sense of it, how we construct the issue in our heads. The narrative really matters. And I think we've got to get real about the narrative. Here's a few bits of the narrative as far as I'm concerned. First of all, this is a dangerous virus, really nasty. It's got a fairly low mortality rate, but it is significant, about 0.5% to 1%, still not quite sure. But if you multiply that up by the number of people who are ready to be infected with this virus, it's going to be a lot of people dying. And then in Europe and in the US, we're saying, well, there's something else. That about 1 in 20 of the people who survive have what's called long COVID. They stay unwell, under par, mentally unwell, physically weakened for a very long time. So as well as having a disease that causes death, we've got a disease that is not unfortunately trivial, that actually causes a long and nasty illness in about 5% of those who get it. It's a disease that is, as has already been said by the president, particularly unpleasant for poorer people. And we've seen that all over the United States, all over Europe, in fact, all over the world. When this disease gets into poor communities, where people are living in confined settings, where people are working in situations where they cannot negotiate the conditions under which they work, where people cannot afford to get access to the healthcare they need, where people are caught up in containment measures and are not heeded, then they get badly affected as well. So there's enormous inequities about COVID. It is a disease that really bites into poorer communities all over the world. And it's currently biting into poor countries all over the world. And it's getting much worse. So the narrative must be that this is a dangerous virus. The narrative must be that this is a virus that, even if it doesn't kill you, can have really unpleasant consequences. The narrative must be that this actually is affecting poor people the worst. And the narrative must be, ladies and gentlemen, this virus is not going away. I'll say it again. This virus is not going away. Even though there are some politicians who like to tell us that it will fade away, using various words to describe it, that's not what I believe. That's not what my colleagues believe. And that narrative must be there in people's minds. And then I'll build some more onto it. There's no certainty that an effective and safe vaccine will appear anytime soon. Okay, so we've got 9 candidates in phase 3 trials, but there's no certainty. There's no certainty that people who are vaccinated will have long-term immunity. There's no certainty that there won't be, unfortunately, side effects from the vaccine. We must not assume that all we have to do is to wait a few months and then we'll all have access to a vaccine. No. And in fact, as we've seen from measles, you can have a really good vaccine, but it's really hard to get people immunized. We've seen from polio that you can spend billions on an eradication campaign, and you keep finding that as you get down to the last few numbers, you don't succeed. And we've seen from HIV that you can spend billions of dollars and years on developing a vaccine, but despite all best efforts, it doesn't come. So we must not put all our hopes in the vaccine. We must hope that there will be a vaccine that we can link together with all the other actions that we know are necessary. And so our narrative should be like this. To get ahead of this dangerous virus, humanity needs to defend itself with all the means at her disposal, all the means. So we need to do everything possible to prevent ourselves from being infected or from infecting others. And that includes physical distancing, masking, all forms of hygiene, isolating when we're sick, and protecting those who are most vulnerable. 5 activities, all of them matter, all must be done everywhere, no exceptions. And then we must make sure that in every community, there are public health defenses ready to pick up people with the disease and to make sure that they are isolated quickly through testing and then efficient isolation. And we must find their contacts, tracing them and then isolating them. And again, protecting the most vulnerable. That is the only way you deal with these problems. That is the only way you stop outbreaks, and it is essential. And if we can get those messages right, then we're in a cool space, because that narrative is really important. But we just happen to have an awful lot of leaders who are currently saying, well, actually, the science is not very important. We're just going to tell you what to think. And if you follow me and believe me, then this virus is going to disappear. Well, I think everything that I've learned about viruses is that by and large, they don't change their minds. They may mutate a bit and change their character, but they don't suddenly change direction. And so whilst I completely understand why great sections of society want to believe that this is a plot caused by 5G telephone masts or by various other conspirators, this is not real. And if you talk to the people whose relatives have died of COVID, they're going to tell you this is not a plot, this is real. And so we're having to deal with the fact that people are looking for somebody to blame. But the narrative I have told you, that I'm sure all of you believe in your hearts and in your souls, is the narrative that matters. And whether we're talking about what happens in Europe, Western Europe, currently facing big returns of this virus, or different parts of the US where the virus just hasn't gone away and it's still very much there and killing people, or Latin America, or Africa, or Asia, or the Middle East, or right over in the former Soviet Union. Basically, we've got to get that narrative clear in people's minds. We've got to remind ourselves that this virus that is doing all these things is revealing inequities that have got to be dealt with. And we've got to be very clear that if we're going to do anything about it, everybody's got to practice the precautions, and we've got to have public health capacity everywhere. Now, that's fine. Narratives are great, but it's only any use if those narratives are pursued by vast numbers of people. Our networks have to be really strong. Instead of working through hierarchies of information being given out by A goes to B, goes to C, goes to D, all in some kind of orderly hierarchy, let's stop all that. We've got to use networks, communities, movements to get the information everywhere, and we've got to use every means possible. And we're not very good at doing that. So building up the networks is an absolute requirement, and that's why I'm talking to you, because the leaders of the future will lead through networks and not through hierarchical organizations. We welcome and value everybody who joins. We make them part of the networks that we're working with, and we do our very best to ensure that they have their place and that we listen to them and they listen to us, because information is vital, but at the same time, we all need to be able to question it. And then thirdly, I come to a third vital requirement, which is nurturing the people as they work with the narratives, as they connect with each other, as they bring about change. Because collective action doesn't happen just on its own. You have to nurture it to make it happen. Look at what Sophia and her colleagues and others did to nurture action on HIV so effectively, bringing together different actors and helping them to feel comfortable, on different platforms or in different venues. And nurturing collective action in ways that put the interests of people first is absolutely critical at this time. And constant and careful nurturing is the way to go. So those are the three words that I've used on COVID: getting the narrative right, ensuring that the networks are working, and then nurturing the connections with people so that change can happen. That's what the task ahead of us on COVID is. It's a long journey ahead. We're only at the beginning, and I look forward to working with you on that. So, does this link to climate, you might ask? I worked on climate a lot when I was in the United Nations, lead up to the Paris Climate Agreement in 2015, and then on to some of the more recent discussions. I watched debates on climate suddenly become much more intense, suddenly involve many more people. And actually, I think the issues are the same. You see, the narrative about climate change, I think, is becoming clearer to more and more people. It's happening now. There are hundreds of millions of people whose lives are being turned upside down by the effects of climate change all over the world. And you're seeing it in California, you're seeing it big time. And don't let anybody tell you that's nothing to do with climate change. Of course it is. And it's all over, all continents right now. And just all the thing we have to do is to keep reminding people, climate change is here. When you're in the middle of something that's a accelerating transformation, you can be forgiven for not noticing it, but it's happening. And we know it's happening. We've got all the data. Very, very good. Second is that networks. Now the networks for climate change are much more involving people who are saying, it's our generation to come and we're being deprived of our inheritance. Could you please deal with this problem? Could you govern for the future and not for the present? So the networks to act on climate change are key. And by making the narrative more focused on what's really happening to people now, the networks can focus on the need for adaptation, the need for resilience, the need to bring nature into climate discussions, the need to talk about people and climate rather than just talk about greenhouse gases or big industrial plants. We make climate real for people. And so the networks need to expand and involve hundreds of millions or billions of people. And then thirdly, again, we need to nurture the connection so that unusual people start working together on climate. And it's happening in California, it's happening across the US. Yes, of course, we're frustrated that the US position in the climate agreements is a bit weakened because of certain decisions. But the US people haven't changed. The people who actually are totally committed to climate action, that make up a very large number of the US population, they haven't changed. And we just have to work to keep the narrative alive, build the networks, nurture collective action, and we'll be able to do the same. And because we will succeed on COVID, I believe that collectively we will be able to act on climate. But one thing that we have to take note of is that too many lives are already being messed up by climate change now. So we have to get it together to work together for climate a bit more quickly than perhaps has been happening. And that's why I ask all of you to join me as leaders for climate action and make certain that you align as closely as you can with what the United Nations Secretary General is doing. He is totally committed for climate action all over the world right now. So those are my introductory remarks. I stop now and I'd like very much to have a discussion. But just before we go into the discussion, let me remind you of my 3 words that I've used. Getting the narrative right, so that it tells the story clearly for everybody with absolute truth, unvarnished truth. If you don't know bits of the narrative, you just say, I don't know, but just speaking truth to people because that's what matters. Number 2, working through networks, because being filtered through hierarchies is really, really time wasting. And networks are the way to go for the future. All the time trying to expand your networks with people that you don't normally communicate with, going beyond your Facebook groups, beyond your echo chambers, talking, making a point sometimes of talking, perhaps even saying to yourself, each week, I'm going to talk about the issues that concern me to at least 5 people that I didn't know before that I wouldn't normally talk to. And number 3, nurturing collective action by making sure you work with the people and helping them to make the shifts they have to. Those are my 3 words. That applies to COVID and to climate. Thank you.
Thank you, Dr. Nabarro. My name is Landon Hall, and I'm with the marketing team at the Keck School of Medicine here at USC. Just say I'd like to, thank you for that presentation. It was informative and inspiring, and your optimism is something I think we need more of. Not only what we can do to kind of help, systems around the world, but what we can do in our everyday lives. And so that was a terrific presentation. We do have a few questions coming in. I'd like to remind people that if they would like to ask a question, just go ahead and type it into the chat, the Q&A feature, and we will get to as many as we can. We've got one here from Samia Reza. You mentioned earlier that this virus is not going away, is not going to go away. We've heard a lot about various maybe possible treatments and philosophies. And one of them is that we've heard a lot about in this country is herd immunity. The question is, do you believe that herd immunity for COVID-19 will someday be achieved, or do the virus's characteristics omit this possibility?
Thanks very much indeed. Thank you, Landon, for this part of the event. Thank you for the question. Here's what I understand. The virus is primarily spread by droplets. That means that usually, if you are more than 2 meters away from somebody or 6 feet, you will be very unlikely to be infected. I want to stress normally. Of course, there are exceptions where there are other means of spread, but that's the normal means of spread. But what it means when you've got a virus that is spread by droplets, it means that outbreaks tend to be really quite constrained. They tend to involve relatively small numbers of people at the beginning. Of course, they grow, but they are spatially very constrained. And indeed, when you look at the statistics on numbers of people in a community who have got antibodies to the virus, and therefore who might have been infected without knowing it, it's still quite small in most places. And so, for example, the UK figures for possible asymptomatic infection are still less than 10% of the population. It was a bit higher in New York, parts of New York, and it's a bit higher in certain rather specific situations like cruise liners, a bit higher in the Iceland studies. But generally, when people get this virus, the level of asymptomatic spread seems to be relatively limited. If that is correct, then that means that there's not a lot of people in communities that have been infected with the virus without symptoms. That means that there's probably not a very rapid spread of the virus beyond those who have symptoms. And that means that probably it will take quite a long period in terms of many months in any community for the numbers of people who've had the disease and who may be immune from reinfection to build up to the 60 or 70% of the population that is thought to be necessary for subsequent outbreaks to be much milder in size. Now, that's very different from what we get with influenza, which is much more likely to be airborne and where you're more likely to get rapid spread, including some asymptomatic spread. Mm-hmm. So the general view is that widespread population immunity is likely to be slow in coming, and that we will continue to have large numbers of susceptibles in populations, and that because of the fairly specific way in which outbreaks build up in certain precise locations, there will be a long interval before there is widespread immunity in populations that prevent these outbreaks from coming. Therefore, banking on herd immunity as a strategy is thought by most of us to be unwise. There are exceptions. There's one country which is thought to be banking on herd immunity, and there are a number of experts who believe that herd immunity is something to work for. I'm saying the cost of waiting till the large number of people in a population are immune in terms of deaths and in terms of disease is super high. And there's this nagging possibility that we're still not able to be certain of, which is that there's just perhaps a possibility that not everybody who is infected actually is protected against further infection. So the basic premise of herd immunity might be an inappropriate one until we're absolutely sure that everybody who is infected is actually protected. Landon, awfully long explanation, but it's one of the most difficult issues, I think, around, and I wanted to try to get it out as clearly as I could. Over.
Right, thank you. The purpose of this talk was to talk about two sort of intertwined, cataclysmic challenges, the virus and climate change. Could you comment more on the intersection of climate change and the pandemic, such as, there are climate refugees, people who are displaced, and it must be difficult to control the epidemic in those kinds of situations where you have people grouped together and a lack of housing. Talk about, this is just such an interesting year and an interesting time where you have, climate change sort of has been omnipresent there, and yet you have the pandemic and the commingling of those two very real challenges.
When I was working in the United Nations, particularly in 2016, one of the issues that I really got affected by was the story of the very large numbers of people, hundreds of millions of people in our world who are moving between countries because changing climate has made agriculture and other activities that depend on climate actually not possible as a means to earn living. And so people are leaving their land, which is drying up because of lack of rain, or alternatively land that is just flooded more and more often, or land which has got saline because of incursion of seawater, because of rising seawater levels. People are leaving this land in the millions to go elsewhere in search of livelihoods. They are the climate refugees. Now, one other thing that I've noticed is that sometimes when these climate refugees move and try to find other places where to earn a living, they're not loved. So if you've got a group of people who earn their living from looking after goats and sheep, and they take their animals to a new area in search of water and in search of green fodder, and the people in those new areas say, wow, what are these people coming along? And they're taking our water. Then you can have a war. And so as well as there being climate refugees, there's also people who are moving because of climate change, but are finding them caught up in fighting wars. So they can then also, as well as being climate refugees, they might be war refugees. And taken together, war refugees and climate refugees, perhaps with climate change as the underlying cause, is one of the major problems in our world today. Now, many of these people who are caught up as refugees, gathered together often in really awful living conditions, are also now being affected by COVID. And that's when things get really bad. On a Greek island recently, there were some restrictions put on the population because of COVID. This led to a demonstration, a fire. The whole place got burnt down. The people are now without places to live. It's caused a major problem. But you can see how COVID coming into places where refugees are living can become like an incendiary influence. And so I totally agree with the questioner that the combination of climate change, migration, warfare, and COVID is a toxic combination for increasing numbers of people in our world. We're not yet fully aware of just how serious it is. But Mr. Antonio Guterres, the Secretary General of the United Nations, has issued a really powerful request to everybody who's involved in warfare. Whilst this COVID is around and causing all this mess, could you please just have ceasefires everywhere? Because we need all the resources we've got to help communities cope with it, whether we're in Syria or in Gaza or in Yemen or in South Sudan or in any other place where there are refugees gathered together. We need to have some kind of absolute moratorium on warfare right now. Otherwise, helping these people is going to be really difficult. Thank you, Landon, for bringing that point up. It's so serious.
It's interesting, in the United States and in other places, there are plenty of skeptics, people who deny the science of climate change and of the dangers of COVID-19. This question comes from Alexander Capron. What methods work best in overcoming doubts that are fueled by partisan and ideological divisions in society? Oops.
That's a tricky question because it's come in two parts. Part one is, how do we deal with the fact that science is being discredited and disparaged in some settings? And secondly, you've added that little extra tweak to the question by saying that this seems to have some partisan feature to it in current politics. And this does make it particularly complex. I've never seen this before, by the way, where we've got actually different sides in political battles taking opposing views on science, and it adds an extra complexity to things. Number one, disparaging science. Well, if you look in history, everybody, there's always been a bit of a fashion for telling scientists that they are wrong, and actually for vilifying them. I don't think anybody likes the notion that there's a class of people who've got the answers to the questions that make us all scratch our heads. And so if we look throughout history, scientists have sometimes been revered and given all sorts of glory, and other times they've been vilified and treated badly and sometimes put to death for their beliefs. And so I think we have to be prepared for the possibility that those in science will get into trouble. I think in order to be, honestly, to be helped as a scientist, I encourage everybody to be demonstrating humility and vulnerability. Because after all, science is fundamentally about disproving hypotheses. It's about showing you're wrong. Certainly that's what science is if you follow the philosopher Karl Popper. And I'm a great believer in this guy. And I've always said that the purpose of science is to prove yourself wrong. The purpose of science is to find that your beliefs are shaky. The purpose of science is to disprove your hypotheses, because that's how knowledge advances. And so I encourage all scientists at all times to display the humility that is appropriate for our trade. I don't always do that, by the way. And I think that we always have to watch each other and not let ourselves get too caught up in our sense of our own rightness. That, I think, actually does make us easier for people to deal with, because they really prefer it when they're talking to people who are prepared to say, well, I'm not 100% sure that I'm right, but this is what I think is happening. Or, as I look at the current state of evidence, this is what it looks like, but in 6 months' time, it could be different. And that's really important for COVID. You know, we have to be super, super careful not to get caught making statements that subsequently turn out to be wrong. Here's an example. You know, there's been a lot of questioning about whether this coronavirus is airborne through nanoparticles. And that point I said earlier about droplet-borne, people are saying, well, you may not be right. I'm quite happy to say to everybody, you know, who knows what's going to be found from deeper epidemiological studies of what's been happening. We've all seen reports of the choir in Washington State that was practicing physical distancing, but still people at the other end of the rehearsal room got infected because of probably some kind of airborne spread. So we have to be straightforward. So number one is my point, that we all have to be recognizing that science is not about certainty and truth. Science is about actually disproving. It's about finding yourself wrong. It's about a degree of humility, because in science, you often are having to say, well, we thought it was this, but after a bit, our experiments and our studies showed it was that. Number two is this partisan behavior of a certain group of politicians just deciding it's fun to vilify scientists and try to kick them. And then there's another group who say, well, actually, we believe the scientists. That, I think, is to do with a particular approach in politics that I can't comment on. The World Health Organization has been subject to quite a lot of this stuff. And I think I have to say that it's outside my actual sphere of competence, Landon. So I'm just going to duck out of it. I really respect Tedros, the head of WHO, who has said time and time again, could we please have a moratorium on politics in relation to COVID, because it's not helping anybody. And he's been beaten around a bit for that, rather nastily and cruelly in a really unpleasant way. I just salute that guy for his bravery and courage. And I will support his position on this. I think we need to do everything possible to avoid politicizing COVID. I don't think it helps anybody. And the evidence suggests that if there is a political debate around COVID, the only winner is the virus, because it takes advantage. And if politicians are arguing about whether people might maintain physical distancing or wear masks, the virus has a really fun time.
Thank you for that. We have time for one more question. We're getting a lot of compliments and plaudits for your presentation. Laura Ferguson says, thank you for a refreshingly honest and inspiring talk. Can you please say something about what you think the role of universities is in the responses to COVID and climate change? How are we as students, faculty, and the institutions best situated to make a difference?
Universities and schools are the hope for future generations to have a better life than we have, for future generations to be in a world where there is greater equity than there is now, for future generations to be full of people who actually enjoy working together and solving problems together, for future generations to enjoy a style of leadership that is collaborative and not competitive. Future generations to learn from women leaders who, by and large, practice collaborative leadership often. We just have to read some of the words of Ruth Bader Ginsburg to see what true women leadership is. So I'm going to say to you that there is energy coming through so much of what's happening in schools and universities. Sometimes there will be anger, there will be frustration, there will be intolerance, there will be despair. Many people in universities, my own children included, tell me that they have really bad times, bad days, bad weeks, bad months, because it does sometimes appear to be so difficult. But the great thing about university, the great thing about the kind of education that you're going through in USC, is it's an education that encourages you to look at all possibilities, all options, and to think things through together, putting people at the center, seeing people as the solution to problems, and working for collaborative solutions wherever possible. When in doubt, collaborate. Compete on the sports field, collaborate when you're dealing with global problems, because it is that capacity to collaborate that is what I say is the hallmark of the humanity that you all represent, which will be the humanity that will lead us through these situations. Doesn't belong to any political party, doesn't belong to any particular presidential campaign, doesn't belong to any particular ideology or religion. It's a human characteristic that we all have inside us and that we can all practice and that we can all be proud of in our homes and in our families, in our workplaces, in our communities, in all our different religious institutions, and in all that we do with our lives. I stop now.
Thank you, Dr. Nabarro. Sophia, back to you.
Thank you all for the excellent questions, and mostly thank you to David for your good humor and substantive engagement in your responses. Much, much appreciated. I want to now offer the floor to Howard Hu, our new Flora Thornton Chair of the Department of Preventive Medicine. He's a physician, a scientist, an internist, a preventive medicine specialist. He's many things with an amazing track record in terms of research and publications. But most importantly here, he's someone who spent the better part of his life working to address many of the issues that we've been discussing here today. So Howard, please, if you give us a few words.
Thank you very much. I am so honored to be on this forum with David. He's been a fantastic communicator, not only of the science, but of the special humanity type qualities that will be necessary to address this intersection of the pandemic and sustainability issues. Here at the University of Southern California, which I've been very fortunate to join this past July, not only have we engaged on the pandemic at the level of both this wonderful department that I have the privilege of leading, but at the university level, but we've also brought together the best transdisciplinary scholars to think about this and not only attack the scientific issues related to inequities, the population health level problems, but also how we even communicate the science to a public that's riven by misinformation as well as the partisan politics that are ripping this country apart. That's all part of what David so well addressed in taking the level of the conversation to individuals, to philosophy, to how we approach this as human beings rather than folks from any particular point of view. And I think that's a wonderful way to approach a hugely challenging intersection of issues. One of the things that I've read from the pundit Thomas Friedman that made so much sense to me is, he recommended as a bumper sticker for the Biden campaign, but this has really nothing to do with politics. It really has to do with where we are today. These words, respect science, respect nature, and respect each other. And that's so much a part of what the challenge is for all of us as we address these two incredible problems. Back to USC and what we'd love to be able to do with WHO at that level is understanding not only how we communicate and use science to figure out the best way to communicate to all segments of the population, but also how we might attack this from the resources that we need to invest. It's not just vaccines, it's all the uncovering these disparate impacts on vulnerable populations, but also how we might address this from a metrics point of view. So many of us are working at the level of understanding the impacts in quantitative terms so we can give our policymakers the information they need to know about the inequities, not just the body count. And we will struggle to move ahead on this on the university level, as David so nicely packaged for us, but also at the humanity level. So thank you, David, so much.
Thank you. Thank you.
Thank you, Howard. Cool. Thank you very much.
And thank you all. With that, let me close by, first of all, thanking you all for attending, for the wonderful and provocative questions, to the tireless and fabulous people who work behind the scenes to make this happen. And I particularly want to call out Doreen Vanderwall at WHO for helping to get this organized, to President Folt, to Dr. Hu, but mostly Dr. Nabarro for an amazing and informative and important exploration of the COVID climate change nexus. That was amazing, and we're incredibly grateful. So to paraphrase Justice Ginsburg, let's commit to fight for the things we care about. And in the words of USC, that means fight on. So thank you, everyone. And please visit our website and follow us to learn more about our work. Thank you again, everyone.
Thank you from me. I have a website, 4sd.info. Don't hesitate to be in touch if you want to contact me, and we can continue the conversation. I want this to be the beginning of a relationship. And thanks, Sophia, for reconnecting. Bye-bye.